Morning. My name is Janice Goodman, and I'm an advanced EMT, have been in the EMS field for about 20 years. I currently work with Hamilton EMS as a president here, and we're going to be discussing the ALS drugs that Dr. Kitch has allowed us to use on our truck. So this Con-A will consist of the ALS drugs. We're going to go over 4 tonight, and as we get through them and to them, we'll also stop, answer some questions, and do some review on it, as well as you'll be able to draw up different dosages. So let's start with the EMR drugs. The EMR drugs that are allowed to give in Martin County are Tylenol, aspirin, oral Benadryl, epi for allergic reaction only, and you can only use the auto-injector for that epi. Oral glucose, Narcan, and that can be administered IM if you have an auto-injector and intranasally. O2 and the topical hemostat agents. The basic drugs that you're allowed to use are Tylenol, aspirin. You can only use Haldol if the patient already has a prescription for that Haldol. You can assist them with their RX if they have a prescription for that. Beta agonist, which is your albuterol. Benadryl orally only. Epi only for anaphylaxis if you have an auto-injector. Glucagon, oral glucose. Narcan, once again, IN and IM. Nasal spray and nitro. Nitro is another drug that you can administer to your patients only if they have a prescription for it. So if they have a prescription for nitro, you can assist them in giving the nitroglycerin. O2 and the topical hemostats. Now moving on to some of the changes that were made by North Carolina protocols for the scope of practice. We're going to first talk about the glucagon that was moved from an EMT level to a, it was moved to EMT from a EMT in paramedic. The antipsychotic drugs have been added, and we just discussed how you're able to do them and who's able to give them. That's the EMT if the patient already has a prescription for them, the AMT. He's also moved steroid preparations to the AEMT level. We're going to talk about some of those tonight. Moving antiemetic preparation to the AEMT level, and he also moved max sulfate to the AMT level. These changes were through North Carolina protocols. So Dr. Kitch has also adopted them for Martin County. So as we move on, you can find at the Pitt County website, or you can also go to the North Carolina approved skills and medicines that you're allowed to give, and you can see a list of those there, of the ones that you're allowed to give. And if anyone, just for a brief reminder of how to read those things, it comes with your medications, and then they're highlighted. Some of them are clear, some of them are red, and some of them have numbers. What you do is you look up that medication, and you go across to your level, whether it's EMT, AMT, or medic, and you look at whether you're allowed to give it. If it has a number there, then you have to correspond with the back page telling you exactly what that number means. And let's just do one for an example. Let me see, let's pick non-steroidal steroid or anti-inflammatory. So if you go across to the EMT, it has an X there. They're allowed to give it. And then for the AEMT, it's highlighted with an X15. So you look at the X meaning you're able to give it, but there's a stipulation to it. So you go over to the back page and you look at number 15, and it says AEMT systems must carry either acetaminophen or non-steroid anti-inflammatory. So it means that you're able to give that drug, but it has a stipulation to it. So you want to make sure you're always looking for the little numbers there to make sure that you are within your scope of practice whether you're able to give that medication or not. So now let's move on to the PowerPoint and start going over some of these drugs and the objectives for this lesson. So the objectives for tonight, we're going to review the expanded scope of practice at AMT level. We're going to review the mechanism of action, the dosages, indications, contraindications for these medications, and the procedures. And the medications we're going to go over tonight are the antiemetics, which is your Zofran, the atypical antipsychotics, which is the Haldol, and steroids, which is the Cytomethanol. We're also going to go over Madaxilofan. So let's start with Zofran on Dansitron. Okay, so the ondansetron is your is the name of your drug for Zofran. And Zofran is a common name for this drug. And this is how it's packaged: 4 milligrams and 2 ml for injection. And it looks like this. I'm going to pass it around so everyone can take a look at this. Please do not open it. Do not put the blue cap on the top. I'm just going to pass it around so everyone can take a look at it. The next packaging we have for ondansetron is the oral tablets. Those are going to be given in 4 milligrams. Excuse me. Those are going to be given in 4 milligram tablets. So I'm going to pass these around also, and so you can get a feel and look at what you're going to give and what you're going to give to look for in the back of the trunk if you need these drugs.
And that, excuse me,
Yes.
is that given under the tongue or on top of the tongue?
We're going to get to that in just a second. That's a good question. What are antiemetics used to treat or prevent nausea? That's what they're for. And the common one is ondansetron, and that's your Zofran. And then there's another one called promethazine, which is Phenergan. We're not going to do Phenergan. We're not going to talk about Phenergan. The one that we're going to be focused on is the Zofran. And Zofran is given for nausea and vomiting. Some of your contraindications for Zofran is hypersensitivity to the medication, prolonged QT or interval GI obstruction. And you also want to be careful giving this medication to patients with liver diseases. Okay? So if your patient has a liver disease, make sure that you're careful about giving that to them. The onset for the Zofran is going to be 15 to 30 minutes. And it usually lasts 3 to 6 hours. Some of the side effects of this medication is going to give you an irregular EKG. Some people might complain of dizziness, headache, chills, drowsiness. Let's look at the dosage. The dosage for your Zofran is going to be the adult 4 milligram. And we're going to get that IV, IO, IM, ODT, and PO. Now, she just asked a minute ago about over the tongue or under the tongue. ODT, does anyone know what ODT stands for? Yes.
ODT, is it on the tongue or on?
No, but that's a good way to remember. ODT is orally disintegrated, which means that the medication is used, it rapidly dissolves in your mouth, and you do not have to have, I'm sorry, it rapidly dissolves in your mouth, and you do not have to take water with that. So you just remember, you just put it in their mouth and it dissolves right away. They do not need anything to drink with that. And you can repeat that in 15 minutes.
So you don't have to put it under or on top? It doesn't matter how it
As long as
is
you
put
put
it
it in their mouth, it does not have to be under the tongue. Under the tongue will be sublingual. And we're not doing this. The only medicine that we use at sublingual is going to be the nitro. Okay? Always make sure you're looking at your protocols to make sure that you're following those protocols when you're giving any kind of medication, not just the Zofran. And you're going to repeat that as your protocol allows you to. Okay. So the protocol for this medication is going to be abdominal pain, vomiting, and diarrhea. And that is for your adult AMPs, and the number of that protocol is going to be UP3, which in your North Carolina protocols, if you look up UP3, you'll see that they have, that is for abdominal pain, vomiting, and diarrhea. That's what your Zofran is going to be. Yes, ma'am.
You said that it's used for abdominal pain. So if they are constipated, does that mean that you still can give it to them because a side effect to the Zofran is constipation? So would you still be able to give them?
I would not give it unless they're nauseated or vomiting.
Okay.
That's what it's used for, is nausea and vomiting. So if you have a patient that's constipated, I would not give them Zofran because constipation is one of the side effects of Zofran. So, look at your handout or if you have your protocols on your phone, look up the protocols for UP3. That's going to be your protocol that you're going to use for Zofran. And if you look down on this protocol on the right side of the protocol sheet, you'll see where it says that you can give Zofran 4 milligrams. Okay. So that's pretty much the ins and outs of Zofran. So the next thing we're going to do is we're going to draw up Zofran. And I'm going to show you how to do it. Then we're going to pause and everybody will have a chance to do this. And we're going to use just some expired medication that we have for practice. If everyone will just get a syringe and a needle and put it on the end of your syringe. We're using lock syringes for this. You just want to put your needle on the end of the syringe, like so. Okay, once everyone has done that, we're going to get one of these. It's just an expired Benadryl that we use. Get one of the expired Benadryl out of there, and we're going to roll up the medication. Now, Zofran for this patient. So, what you do is you take the cap off of your Zofran and uncap your needle, and then you want to pull your syringe back to inject some air. Excuse me. Take your alcohol swab and clean off the top of your valve, and then you're going to inject the needle into the valve, just like any other medication you're drawing up, and put some air in it. And then you're going to pull up 4 milligrams. Okay, with that being said, recapping needles is not advised, but in this situation, we're going to give this IV. So we're going to take the needle off, clean your port on your patient's IV, put your syringe to the IV, and inject the medication. Okay? So that's just an example of Zofran. So now we're going to answer some questions. So the next thing I'm going to do is I'm going to pass out a list of review questions. And you have 4 on these sheets. You've got your antiemetic drugs, your psychotic drugs, your steroids, mag sulfate. So everyone has one of those sheets. So now let's go over what we just talked about. Okay, so the first question is, what are antiemetic drugs used for?
Nausea and vomiting.
Nausea and vomiting. What is the brand name for ondansetron?
Zofran.
Ondansetron, I'm sorry. Ondansetron. Zofran is correct. What's the adult dose for ondansetron?
4 milligrams.
What are some of the routes that we're going to give this drug? IV, IO, IM,
PO.
PO, ODT. And you can repeat this in 15 minutes if the protocol allows. So, what is your pediatric dose for ondansetron?
You got to go by the Bravo tape.
We're going to use the Brazos tape, but it's 0.2 milligrams per kilogram. And what's the maximum we're going to give each children?
0.4.
4 milligrams.
Oh, 4
We're
milligrams.
going to give 4 milligrams. What are the routes of Zofran for your pediatric patients? With a maximum of 4 milligrams, your pediatric patients are going to be taking this IVIO, IM, ODT, and PO just like the adults. And you may repeat that in 15 minutes. All right, let's talk about some of the contraindications. We went over it we looked at it a few slides ago, some of the contraindications. What goes on with the EKG?
It's irregular.
You might get an irregular EKG from patients taking this medication. It's very rare, but they may get irregular EKG. They may complain of dizziness, headache, chills, and maybe drowsy. What is our protocol for Zofran?
Used for abdominal pain, nausea, and vomiting.
Abdominal pain, vomiting, and diarrhea. That's the name of the protocol. And what's the number of that protocol?
UP3.
UP3, very good. All right. So that's a review for Zofran. Any questions this far on what we've talked about? We've talked about Zofran, We've talked about the injection, we've talked about the tablet that incinerates in your mouth. You don't need any water to take these tablets. We've talked about your dosage, we've talked about your adult and pediatric dosage, contraindications, and indications for the drug. Any questions thus far on anything that we've covered as far as Zofran is concerned? Okay. If no questions, we're going to move on to the next drug, which is going to be haloperidol, which is commonly called Halidol. And this is one of your psychotic drugs. And we're going to first talk about some of the typical and atypical antipsychotic drugs. So let's look at the difference between them. Both of these drugs include a mechanism of action and a side effect. So you got your typical and your atypical. We are going to carry the typical, which is the Halidol. That's one of your typical antipsychotics. EMS does not carry the atypical antipsychotics. This is some of your psychotic drugs that are for longer use for patients with a lot of psychotic issues. And the drugs are used for schizophrenia and stuff like that. Ours are going to be the drug that we're going to use is going to be Halidol, and that's going to be your typical antipsychotic drug. So the typical ones, let's talk about that for a minute. They have an effective, they affect the dopamine receptors, leading to a higher risk of extra pyramidal symptoms. And we're going to talk about what that word means in just a minute, the extra pyramidal symptoms. We're going to talk about what that means in just a second. So also your typical drugs are a broader range of psychotic, or for a broader range of psychotic conditions. So the atypical drugs, the EMS, we as EMS pre-hospital care do not carry those drugs. We don't have those antipsychotics on the truck, and they affect serotonin receptors, offering a broader range of symptom relief and are generally better tolerated. Preferred for long-term treatment due to lower risk of extra pyramidal effect. And there's that word again. We're going to talk about it in just a minute. The atypical drugs often used for both positive and negative symptoms of schizophrenia. And the last thing with atypical drugs, it is associated with potential metabolic risk and other side effects that require careful monitoring. So people that are on these atypical drugs are going to have blood work drawn periodically to check and make sure that their levels are good for taking these drugs long term. Okay, extrapyramidal reaction. Extrapyramidal reaction. This is a reaction that is characterized by involuntary movement, contractions of muscles and extremities, such as muscles of your face, your neck, your abdomen, your pelvis, or larynx, in either sustained or intermittent patterns to abnormal movements or postures. Something like with a seizure. They get their name because they are symptoms of disorders in extra pyramidal system, which regulate your posture and your skeletal muscles. All right. Extrapyramidal reaction. may become immediately or can be delayed for hours to days. Rarely is this life-threatening. Usually it resolves within minutes and may reoccur subsequently over days after taking this medication. Halodown may cause dystonic reactions, and that's the reversal extrapyramidal effect, where the body is just moving out of control. Okay, let's look at the treatment for extrapyramidal reactions. The treatment is going to be 50 milligrams of diphenhydramine, which is Benadryl, IV, IOIM for adults. And then for your pediatric patients, you're going to give 1 milligram per kilogram. And that can be given IV, IOIM, or PA. And the symptoms usually resolve with this in 10 to 30 minutes. Any questions? Okay, let's look at your atypical antipsychotic. They're also known as your second generation antipsychotics. These medications are used to primarily treat psychotic disorders such as schizophrenia and bipolar patients. And they're used to treat agitation associated with dementia, anxiety, autism, and some delusions. These medications are not commonly carried by EMS. Patients will have these medications prescribed by a physician. AEMTs can assist them in taking the medication by following their prescription. All right. Some of those drugs, there's a broad range of them. We're just going to touch the bases and talk about a few of them. And those are going to be like your Seroquel, your Abilify, your Risperidol. And there's a picture of what your Risperidol looks like and the Abilify. And those are your atypical antipsychotic drugs. Those are the ones that are prescribed to the patient. So let's talk about your typical antipsychotic drug that we're going to be giving on the back of our truck. And that's going to be haloperidol, which is Halodol. Halodol is the common typical antipsychotic drug that we're going to use, and it works by blocking dopamine activity in the brain. Reduces hallucinations, delusions, and other symptoms of psychosis. Used to treat agitation, hallucination, and combativeness. And a lot of times we get patients who are combative, psychotic patients who are very combative. So this is going to play a big role in those patients that are combative by giving them Halodol. Some of the common terms you may see with these drugs are adrenergic system or cholinergic system or the synapse. And this is just some of the common terms that they go over just for your information about these drugs. Like your cholinergic drugs stimulate the parasympathetic system, and that increases acetylcholine released into the synapse, the structure that permits a neuron to pass an electrochemical signal to another neuron. This is commonly what you all know it as the fight or flight method, is how we can remember that. The anticholinergic drugs reduce the effects of cholinergic drugs. They work by of acetylcholine into the synapse. In a simple sense, they are drugs that can turn on the system in the body that causes fight or flight, and we just talked about that. A histaminogenic acts in the brain has an important role to making sure that you are awake. Maintains wakefulness. Neuroleptics, antipsychotic medications, they block dopamine receptors in the nervous system, mainly for mental ill patients, such as the patients that are schizophrenic or bipolar. And let's go back. Dyskinesia, that's uncontrolled or involuntary movements. The disc, and then the skin, amnesia, uncontrolled or voluntary movements. All right, so let's talk about some of the dosages for this haloperidol. Adults, we're going to give 2 milligrams to 10 milligrams. How are we going to give it? IVIM. Some of the special considerations for this drug is that the child must be 12 years old. Also, another special consideration is going to be your elderly people. Anyone that is greater than 65 years old. You're going to cut that down because they don't need as much of the drug. And they're going to give 2.5 milligrams IM. This drug is not used for pediatric patients. Some of the indications is agitation, hallucination, combativeness. Contraindication would be a hypersensitivity to the medicine. And medication to assist with sedation and agitated patients. Let's look at the protocol. The protocol we're going to use for Haldol in a pre-hospital setting is going to be the behavior protocol, which is the adult UP18 protocol. There's also a skill that goes along with that, and that's the ASP11. That's a check sheet that goes along with that protocol to make sure that you try to de-escalate that patient from going into a bad state. And make sure that you're checking your skills with your protocols, because you want to make sure you've done everything you can before you give this patient Haldol. Okay, let's practice. We're going to do basically what we did with the other medication, Zofran. And if you pull up on your phone, that most of you have your protocols on today, people just don't use paper anymore. Everybody uses phone for everything. So pull up your North Carolina protocols and look at the behavior, agitation, sedation guide, which is, what's the protocol? UP18. Let's look at the UP18 protocol. What we're going to be using to give the Haldol. And if you look down on the right-hand side of the page, ages greater than 12, Haldol 2 to 5 milligrams. And patients that are greater than 65, they're going to get 2.5 milligrams IM. So, the Haldol, let's see if I can find it. There's one. Please don't open it. But this is your injection for Haldol, 5 milligrams per milliliter. And everyone grab another syringe and a needle. And we're going to do just like we did before. We're going to pop the top on the Haldol. Clean it off with alcohol. Inject your needle and put some air into your valve. And then you're going to draw up. How much are we drawing up? How much Haldol are we giving this patient? 2 to 5 milligrams. Now this is just a rule of thumb that I go by. When I'm allowed to give a patient 2 to 5 milligrams, and I've never given this patient Haldol before, and I don't know what kind of reaction they're going to have to the medication. Most likely, and this is just a rule of thumb that I go by, when I'm allowed to give 2 to 5 milligrams, I'll start out with a low dose. Because I can give them 2 milligrams, and if they have a bad reaction to that, it would have been worse if I'd have given the whole 5 milligrams. And you can't reverse that. If 2 milligrams has not made a difference, you can always add some more up to your 5 milligrams. But if you go ahead and you shoot them with 5 milligrams and they have a bad reaction, because, a lot of times we come and encounter people on pre-hospital setting, we've not given these medications to these people before. A lot of them, we don't even know, never seen before. So just as a rule of thumb, I'll give them 2 milligrams, see what kind of reaction they have, and chart my reaction. And then I'll give them a little more if it's not working. Because I can give them up to 5 milligrams. But once I give them the full 5 milligrams and they have a bad reaction, I can't reverse that. So that's just a rule of thumb that I go by. So I would start out with 2, and if it doesn't affect them, I'll give them a little more. Maybe give them 2 more. But you can give up to 5 milligrams on the Haldol. Now, your verbal de-escalation is your ASP-11 skill sheet that we talked about. And that is just making sure that you try to de-escalate the situation. The ASP-11, and you can see that. It's right down the website of the protocols and your skills. And it's just going to ask you questions such as are you listening closely to the patient? Do you agree or disagree with what they're saying? Set some clear limits on acceptable behavior. And you're going to check yes or no there, or provide able to complete skill satisfactory thought instructively a teaching intervention is the IL. But that's just one of the skill sheets that goes along with that protocol to make sure that you're de-escalating the situation. Okay. Any questions on Haldol? Any questions on Haldol? We talked about the interactions, contraindications. We drew up a medication. Everybody got to touch and look at the valve. We talked about we're going to do this with pediatric patients. Okay. So let's go over some questions with the psychotic drugs. This is just a little review on the psychotic drugs. What are psychotic drugs used for per our protocol? Sedating a patient or agitated patient. 2 to 5. IV and IM. What are the routes for Haldol for your adult patient? And how often are you going to give it? IV and IM, you're going to give it one time up to 5 milligrams, and they must be how old?
12.
They must be 12 years old. Do we give this to pediatric patients?
No.
Okay, and some of the contraindications would be hypersensitivity to the drug. What protocol is used for Haldol?
UP18,
UP18, what skill sheet?
ASP11.
ASP11. Any questions on Haldol? No questions? Let's move on to the steroid. Okay, so we're going to talk about Cyanidrol. Cyanidrol is a steroid that we're going to be giving them. It's 125 milligrams. So I'm going to pass this around and let everybody take a look at it. Please don't mash it together because your Cyanidrol comes in a powder and a liquid form. And you mash this together and do in a circular motion. Do not shake this medication to mix it all together. But I'm going to pass it around so everybody can take a look at it and be able to know what they're touching when they get on the truck. EMS uses steroids for respiratory stress due to bronchoconstriction, such as asthma, COPD, emphysema, pneumonia, and anaphylaxis. Common EMS steroid that EMS uses is methylprednisolone, which is Cyanidrol, and it's a corticosteroid. And then this is just tells you a little bit about corticosteroids here, that it's in the class of anti-inflammatory medications. And the common type is prednisone. Some of the side effects for steroids is going to be the weight gain and your high blood pressure, and also the increased risk of infection. Let's talk about the dose for Cyanidrol. The adult dose for Cyanidrol is going to be 125 milligrams, IV, IO, and IM. Pediatric, 2 milligrams per kilogram with a maximum of 125 milligrams, IV, IO, and IM. Always make sure you're going by your Brazil tape and you're following your protocol. Special consideration to this medication is that it's going to increase or give you hyperglycemia. So be careful with your diabetic patients. If they already got a sugar of 400, do not give them this medicine. Steroids do elevate blood glucose, and the contraindication to this medication will be hypersensitivity. So we just talked about how to administer the medication, how to mix it together. So you want to mash the top where the liquid seal is, and you want to mash it through and mix the solution with the powder that's in the bottom. Then you're going to pop out this round circle that's on the top, and you'll see a plunger. Once you pop out that circle, you're going to see a plunger there. Wipe off the top of the plunger with your alcohol prep. Draw up your desired dose. Make sure that you're dispensing the air by tapping your needle if you need to, and give your medication. So you mash it together. Make sure that the liquid is into the powder solution. And you're going to kind of swirl it around. Do not shake pop your plunge, this little tab out at the top, and there's a plunger there. And that's how we're gonna draw the medication up. Okay. So there's no need to draw that one up because we don't have any expired, valves in that. So we're gonna kind of move on to the protocols used for this. And, the protocol is gonna be allergic reaction, which is anaphylaxis, and that's gonna be AM1. Your COPD in animal patient, pediatric allergic reaction, and the pediatric respiratory distress. Those are the protocols that you're going to use for cytomedrol. Okay, let's go over a few questions with your cytomedrol. Let's go over the questions and then we're going to wrap up the session on cytomedrol. Any questions on anything we've gone over so far? We've talked about Haldol, cytomedrol, and Zofran. So now let's go over, let's review this, your cytomedrol. Okay. What are these drugs used for?
Respiratory distress.
Respiratory distress. It's a steroid that we use for respiratory distress. All right, what is the brand name for methylprednisolone?
Saldronate.
Prednisolone, sorry. Cytomedrol. What is the adult dose for cytomedrol? 125 milligrams. IV, IO, and IM. What about the pediatric patients? How much are we giving them? 2 milligrams per kilogram.
Up to 125 milligrams.
That's right. Up to 125 milligrams. And what are the routes that we're going to give this medicine?
IV, IM, IO.
Yep. And how many times are we going to give the medicine? How often?
Every,
One time.
oh,
Just give this one time. Go by your protocol. What are some of the contraindications for the medication? If they have a hypersensitivity to the medication.
hyperglycemia.
Hyperglycemia. That is a side effect of the medication.
Oh.
It will make your blood sugar go up. So be careful. If you've got a patient that your sugar is in the 400, you don't want to give them this medication. Okay, and what are the protocols for cytomedrol?
AR1,
AR4,
AR4,
AM1,
AM1,
PM1,
and AR7.
and AR7. And we're giving this for allergic reaction, anaphylaxis, COPD, pediatric allergic reaction, and pediatric respiratory distress. Okay, good. So that kind of wraps up the class on the AEMT drugs that we're going to put on the truck at this point. Are there any questions about anything we've gone over tonight? Anybody have any questions? Okay,